Good morning, and thanks for joining us. I'm Teresa Freed, Assistant Director of Public Affairs and Communications for Johnson County Government. We have with us Dr. Sami Ariola, Director of the Johnson County Department of Health and Environment, and Allison is providing ASL for us today. Thank you guys for joining us.
Thank you, Teresa.
All right, if you just want to start us off by talking about how vaccinations are going.
Thank you. Good morning, everyone. Clinic in Lenexa has been vaccinating this week. Yesterday, we had a clinic from 9 a.m. to 3 p.m. and we vaccinated just under 1,000 persons yesterday. We expect the same today, and tomorrow clinic is running 3 to 7 p.m. and on Saturday it's running 8:30 to noon. And not only have we seen an increase in the number of appointments, largely in the 12 to 15-year-olds, we are also seeing an increase in the number of walk-ins. And so people are getting vaccinated still, which is what we want. We're still getting the shots into people's arms, inching up gradually in terms of our movement towards our goal. Again, our denominator changed last week once the Pfizer vaccine was approved for 12 to 15-year-olds. And so as we are updating our numbers later today, note that the denominator is going to change. For 16 plus, there's I believe that number was slightly over 464,000. Now it's slightly over 500,000 that are eligible. So while that percentage may drop a little, the goal hasn't changed. Even as we are vaccinating in our clinics, we are making plans for community clinics. We are reaching out and have a link on our website where businesses can let us know if they want to work with us, if we need to bring vaccination to their work site and vaccinate their employees and their families and friends. We are working with other organizations. This Saturday, I believe, we are going to be working with Pastor Bobby Love and Second Baptist Church and vaccinating there. We have plans in June to have events in several churches across the county where we are vaccinating people on Saturday and Sunday, and we'll be releasing more information about those very soon. So, and there's so many things that are going on. We're working with pantries, farmers markets. We recently had a long meeting with the city of Overland Park and really exchanging ideas and so many activities that we expect to occur in the next few weeks where we are collaborating, working together and vaccinating. And again, just really for me, just a brief shout out to Bill Abel and the rest of the officials in Overland Park for that gesture. And so again, the bottom line is even as we are vaccinating in our mass vaccination clinic, we are having community events and vaccinating and getting shots into people's arms. And it doesn't have to be at our events. Our partners are vaccinating, our health systems are vaccinating, pharmacists are vaccinating. It's just a lot of opportunities for people to get vaccinated. There's a lot of primary care physicians, private offices that are vaccinating. So collectively, we are inching closer to our goal. Not quite there yet, but you can tell from our numbers, from the number of deaths, from hospitalizations, that we're beginning to break that chain, that cycle of transmission. We're making it a dent. Every single shot that we give, it's a dent. And every single shot that we give is an additional person that the risk of infection becomes very low and their risk of transmission becomes very, very low. So the more people that will get vaccinated, the higher our chances become in suppressing, mitigating, and containing this virus. And more importantly, the higher our chances are of preventing mutations so that we don't have variants of of public health importance. The more people that are infected, the higher the chances of the virus mutating. But we have done well. There's obviously more that we can do, and finally, last week, CDC, Centers for Disease Control and Prevention, came up with some information about those that are vaccinated. And in the past few days, I have seen that people are interpreting that conveniently. So what that guidance is for those that are vaccinated. It's really saying that those that are vaccinated, these are the things that you can do. You can be without mask because we know that the vaccine is very effective. It works. It prevents you from getting infected. It also reduces your chance of getting others infected. We also know that even the small fraction of that breakthrough infection that we talk about, even when that happens, they're very few, but even when they happen, most people that are vaccinated either get no symptoms or very, very mild symptoms. So that's that. We also know in our region that 100% of those that are hospitalized right now are unvaccinated. And so that guidance is for those that are vaccinated. So the question is, if you are not vaccinated, you should continue to wear mask. You should continue to physical distance. So the guidance is not a removal of the requirement or the recommendation to wear mask. And I want to repeat that the guidance from the CDC is not a removal of the recommendation to wear mask. That recommendation stands. That guidance is truly for those that are vaccinated. If you are not vaccinated, there are really two choices you have: wear mask or get vaccinated to protect yourself and to protect your loved ones. Thank you.
All right, that's great information. Back talking a little bit about more on children being vaccinated. I know school is letting out now, and we've been working closely with the school districts to either have clinics or give them good information about the availability of vaccines that we have through our clinics. So can you talk about that ongoing coordination that's going to be happening through the summer months with the school districts?
Yes, we have been working very closely with the school districts right from the beginning of our response to this pandemic. We have worked collaboratively. We are in constant touch, not just with the superintendents, with school nurses and other officials, and really proud of that collaboration. That's the way it should be, and it's been. In some cases, we've had to make tough decisions, and we've been very clear from the start that we provide recommendations. The final decisions with the schools. However, a couple of things. Number one, our recommendations to school, just like CDC's recommendation, has not changed. The CDC's guidance did not change their last or most recent recommendation to schools. Masks continue to be very, very important to prevent infections in school, largely also because we do not have a lot of vaccinations. We just had the vaccine approved for 12 to 15-year-olds. We don't have vaccines for anyone younger than 12. Now, the added advantage is we have vaccinated staff, teachers, custodians, administrators who wants to be vaccinated. So those are added advantages, but I want to make it very clear, and that's reflected in my last letter to the schools. It's nothing in last week's CDC's guidance takes away the need or the advantages of wearing masks in schools. I want to make that clear. My recommendations to them have not changed. Wearing mask continues to be very important for us to prevent infections in the schools. And we are seeing a lot of the infections that we're seeing right now, actually virtually only very few breakthrough infections. A huge percentage of them, most of them are in unvaccinated persons. They are occurring in younger persons. We are seeing a spike in infections in 10 to 19-year-olds, which would be school-age children. And so that continues to be very important. In terms of our efforts to vaccinate in that group, Children Mercy Hospital, we've worked with them. They are vaccinating, we are vaccinating. They've got events planned for that age group, not just events, but sustained efforts to sustain vaccination in that age group. Our health systems are vaccinating, pediatricians are vaccinating. And so very, pharmacists are vaccinating, we are vaccinating, all those efforts are ongoing. We also know that a couple of the school districts have providers. They're able to also to administer vaccines. So it's going to be this collective effort that is sustained over time that is going to let us get our adolescents vaccinated. I'll have to say that from last week to now, I have been very encouraged. It's really, really nice when we see hundreds of families walking in and booking appointments and getting the shots into the arms of their children. I'll tell you, if I have a child that's playing summer sports, and in many cases, those summer sports involve interactions with several other people, some from other districts, some from out of states. In some cases, kids play travel sports where they go around to states where infection is a lot higher than what we have here. And so why would you not? Why would you not take that step that protects your child? I did say, and I'll say that again, nationally, since we've started this responding to this pandemic, over 1.5 million infections have been reported in children aged ages 12 to 17. 13,000 of those have resulted in hospitalization. So yes, younger people do get infected, younger people do get sick. So the opportunity is here for anyone that's 12 or older, get them vaccinated. We are vaccinating, opportunities will continue to remain for that age group. Children Mercy is doing the same thing, and our hospitals and pharmacists are doing the same thing. Lots of opportunities to get your child protected.
And I know there was a pretty good gap between the time that the vaccine was approved for the 16 to 18-year-olds and then now the 12 to 15-year-olds. So can you talk a little bit about what's next? I understand there's some clinical trials happening even here in the Kansas City area for the younger children.
Yes, thank you. There are trials that are ongoing for younger children to get vaccinated. So the efficacy and the safety is being tested, is being evaluated. And it's not just the Pfizer vaccine, but it's also Moderna. And I believe that Johnson & Johnson is also doing that. So I think in the next few months, we'll have the opportunity to protect even more of our population. And that's the goal. It's the fact that we have vaccines that are effective. We have vaccines that protect from not just death and hospitalizations, but from severe illnesses. And unlike anything that we've seen before, being able to have this many vaccines in a short time, since we're responding to this, and now the opportunity to be able to protect even our younger folks, something that I think will be terrific. But yes, those trials are ongoing, and hopefully in the next few months we have approval for those and get our children protected. Because I speak to a few parents, and they have children that are younger than 12, and some of them with conditions that make them more susceptible to some of the more serious consequences. And my message to them is a little bit be careful while we're waiting. Wear masks, physically distance, do all the things that you have been doing to protect yourself and your child. And hopefully in the coming months, we are able to get a shot into their arms and they're better protected. What we know is the protection that you get from the vaccine has proven to be pretty good, pretty efficacious against even the variants that we have. And so, and that's a good thing. So hopefully that benefit, we can extend that to the rest of the population.
And just one more question about related to children. So children who are medically fragile might not be able to come to clinics. Are we still providing those homebound services for vaccinating as well there?
Yes, we're doing homebound. We're still doing that. I think last time I checked, we have gone likely through our list. But I also know that yesterday or a couple of days ago, I got an email from somebody who is homebound. So yes, we're still doing that. We are doing that largely now for our older population, and we have not extended that to the younger folks. So again, for children 12 to 15-year-old, they do need parental consent. We do need parents to be with them, but in the cases where transportation or it is easier for us to give the vaccine in the homes, those that are listening, please reach out to us, and we'll do our best to get to your home and get you vaccinated. So we've got staff that have worked so diligently on this. They every time I speak to them, just the level of satisfaction that they are really providing services that which is what public health is really. That's what we do. It's our satisfaction is in providing those services and filling in the gaps and creating conditions where our residents can be as healthy as they possibly can. And one of those is and doing it whichever way that we can, whether it's coming to your home or being in the community or you coming to us. We do what we can to make people healthy. And so talking to our staff and just seeing the excitement and the satisfaction in their faces when they come back, when they're going and they have their list and going into homes to vaccinate, pretty incredible. Which is why a lot of our staff are in this business, just to create conditions where people can be healthy.
All right, so back to the popular topic right now of masking. We talked earlier this week. There's a lot of different messages on masking, even at businesses. I think most recently we saw Walmart and Target starting to relax masking policies at their stores. And so are there any efforts right now to provide some consistency on how businesses are messaging whether or not you need to mask?
Right. So we a big part of our job, a big part of our approach throughout the pandemic has been in providing information to the public, and some targeted information in some cases to businesses, to schools, long-term care facilities. We've done that, and we'll continue to do that. We have moved as a county from having a mask mandate to a strong recommendation of mask, and then the CDC guidance came out, and so that changed a little bit. However, our messages to the businesses will continue. And while it's their individual prerogative to decide what they do, I think working for us as a county is the fact that our infection numbers are low. First. Second is the fact that infections are occurring in people that are not vaccinated. So, but third also is the fact that anyone that wants to get vaccinated, who is eligible, can get vaccinated. We have enough vaccine in the county. So those are the three factors that we have to consider. But we will continue to reach out to the businesses to ensure that they understand that mask guidance is very clear. It is for those that are vaccinated. And I know how difficult that would be in terms of policy for businesses. How do I determine who is vaccinated and who is not? So there's going to be a lot of personal responsibility here for people that are vaccinated. If you choose to continue to wear masks, that's completely great. I also know that there's going to be a period of transition for people to feel comfortable Personally, for me, there will be situations where I wear mask. If there's a crowd, I'll continue to put on my mask. Or if I feel like I'm dealing with vulnerable persons, I'll continue to wear my mask. So you can't go wrong by being more careful. There's no question about it. And while we cannot police people and check vaccination statuses, it is very important to know that, again, the guidance in terms of, it's not, I don't even think it's okay or it's appropriate to say relaxation of the recommendation. That's not what the CDC did. It was basically clarifying that those that are vaccinated can begin to do these activities. You can do this, you can do this, you can do that. If you are not vaccinated, then you don't really qualify for that. So if you're not vaccinated, you need to continue to wear masks, both to protect yourself and to protect others from you. Or again, we know that there's still a percentage of our residents there who are not vaccinated, either because they want to see what will happen with people that have been vaccinated. Now we've vaccinated millions of people. There are others who are not really against vaccination. They either access issue, maybe they're working, and that's why we are going to be in the community. So, and continue to provide opportunities for people to get vaccinated. But to be clear, if you're not vaccinated, you are at risk. If you're not vaccinated, wear a mask. If you cannot be vaccinated for whatever reason, medical reasons, or choose not to be vaccinated, wear a mask. Protect yourself, but you also have a responsibility to the community to ensure that we are not spreading the virus and making our vulnerable persons sick.
And I think you've mentioned before, but maybe speak again about, if a substantial amount of our population is vaccinated, we're protected, but we're also helping the people who are unvaccinated around us.
Oh, absolutely. There are always going to be a proportion of our population that cannot be vaccinated. I'll give an example. Polio, for example. To get to population immunity, we need to vaccinate 80% of our population. For measles, that number is 95%. What that means for polio then is the 20% that cannot be vaccinated or choose not to be vaccinated. If we others that are eligible do not have any medical reasons to not be vaccinated, if we vaccinate 80% of our population, then we provide indirect protection to the other 20, because we basically snuff out the virus from spreading. We break the chain of cycle of transmission enough that we not only mitigate, we contain the spread. And so population immunity is a way to indirectly protect the rest of the population by vaccinating enough persons. That number for polio is 80%. And so that's the same thing for here. While we're not quite sure of the number, we think that if we are hitting 70-75% vaccination, we that are vaccinated, we that could be vaccinated, would be indirectly protecting the 20-25% that cannot be vaccinated for medical reasons or for other reasons. So very, very important for us to keep the efforts going.
All right. So we're not quite there yet, but we are getting there. I'm going to pause for just 1 second here to see if the media have any questions. And I'm not seeing any. So any last remarks before we close out?
The opportunity to get vaccinated is there, and we have our clinic open in Lenexa several days a week, and that will continue for a while. We have our partners are vaccinating, our health systems are vaccinating. We are focused on our 12 to 15-year-olds now, but we're still vaccinating 16 to 18-year-olds and older adults. A number of vaccinations in our population younger than 50 needs to go up. We've done very, very well in vaccinating our 50-plus population. So the vaccine is available, and I continue to encourage you. again, I am pitching this as not just personal protection, but also as a measure of our responsibility to the community. There's going to always be a certain percentage of our population that cannot be vaccinated. It's on the rest of us to ensure that we get vaccinated and protect our community. Also, it's our quickest, fastest path to returning to life as we know it. And lastly, let's be sure that we don't misinterpret the CDC's guidance on masks. It is basically saying that those that are vaccinated can begin to do this. So it's not a license for a mask is going away. That's not what that message is. We want to make sure that that's pretty clear.
Sounds good. Well, apparently we didn't cover everything. We have a couple of questions from the Shawnee Mission Post, so I'm going to go ahead and unmute.
Hi, good morning. Can you hear me?
Yes.
Yes, Dr. Ariola, thank you so much for the information. I just had a couple of follow-up questions. You did say, or you mentioned, and I don't know if you were talking nationally or here locally, that you had seen a spike in the 10 to 19 age group in terms of new infections. I wanted to see if you could say more about that. And in conjunction with that, I had also noticed there was a little bit of a jump in the overall incidence rate. So where are you seeing new cases demographically? What types of people are you seeing getting infected?
Thank you, Kyle. Across the region, we are all seeing an increase in cases in the 10 to 19-year-old range. So I'll have to take a look at the national numbers, but across the region, that's what we're all seeing. And nationally and here, infections are occurring in people that are not vaccinated, and those are largely younger people because we have vaccinated a lot of our older population. So our numbers are increasing in the younger than 50-year-olds in general. But also our number of vaccination, we'll get the number today, but last week that number went up in that population, which is a good thing. So a quick answer to that is infections are occurring in unvaccinated people, and right now they tend to be younger folks, younger than 50-year-olds. In terms of, I think there's a second question that you asked.
Yeah, I mean, I kind of combined two questions, which may not be good practice, journalist. I did want to know, there was a little bit of a lull in vaccine rates, and then you had said that you were encouraged by the number of people you had seen come in recent days, and you're attributing that really to an uptick in the 12 to 15 group that's newly eligible.
That is correct. And then you did mention the increase in the number of cases that you see on our website. So I do want.
Yes, so the incidence rate. Yes, thank you.
Yes. So we did add a footnote there. We have a couple of entities that are just recently in the past few days uploading data from several months ago. So that's why we included a note that so it's looking like our numbers gone up. Really, it hasn't. It's because they are dumping in cases that should have been there earlier. And so if you look at the graph on our website that's showing, I believe, lab report date or lab analysis or something like that, that would be more accurate. But so the number that you see that goes up is really likely because a couple of institutions are just reporting data from several months ago. So not a big reason for concern in terms of that. Again, in terms of generally in terms of our numbers for vaccination, the reason why we have seen an uptick from last Thursday until now is because a lot more of the 12 to 15-year-olds are booking appointments and are walking in. Prior to that, I was looking at the Excel file where we track the number of appointments. That number was really going down. So the increase that we've seen from last week is really because of vaccination in the 12 to 15-year-olds. I would say also the increase in the number of walk-ins, because I think last week, Wednesday, I think we had or sometimes last week before the approval, our walking numbers were very low. I think one day we had less than 10. But our number, I believe, as Saturday, based on data, preliminary data, did show that we have over 300 walking. So, so that's working. 12 to 15-year-olds are coming with their parents to get vaccinated, and that's a good thing. Yeah.
And just to clarify, you say the 300 walk-ins, that's been since last Saturday?
I believe that's on one day. In one day, yes.
And the less than 10 was a day last week before the new eligibility was announced?
That is correct, yes.
So would that imply then maybe that the group that's older than the 12 to 15, but younger still, like people basically in their maybe older teens or 20s, maybe they're not getting vaccinated at rates that you would like?
That is correct. And but again, I have staff that are working on that, and it's not. I don't want that to be interpreted as they don't want to be vaccinated. They most of the time they will not go out of their way to come to the clinic. So we're working on ways to take the vaccines to them, and that we are going to be providing more information in the coming days. We feel like when we take the vaccine to them, they will get vaccinated. And that's not just us. That's what we are seeing across the country. So the younger folks, 20 to 30-year-old, 30 to 40-year-old, we are really mapping out our community clinics to target those age groups. Not because they don't want to get vaccinated. They probably would not go out of their way to come to the clinic. So we'll take the vaccines to them.
And this is my final question. I know you got to go, but what would those efforts look like in trying to reach out to those populations?
I will be providing more information about that in the coming days. It's again what I said. It's largely taking the vaccines to them. It's looking at the lifestyle, what they like to do, where they like to go to, and then modifying our efforts to meet them at those points. Yeah.
Thank you so much.
You're welcome.
All right, thanks for those questions, Kyle. And I think we'll go ahead and wrap it up. So we will be back here again on Monday at 4 o'clock. You can also tune into the Board of County Commissioners meeting tomorrow for another public health update. Have a great day, everyone.